Prestige HealthNet, an in-depth look at our healthcare service. At Prestige Technology, we're dedicated to transforming hospital and healthcare IT from a costly burden into a trusted, reliable tool through our HealthNet service. We do this by directly addressing the most prevalent difficulties that hospitals face. But understanding what sets HealthNet apart from other IT services requires a good grasp on healthcare IT pain points and why they're so important to address. In this in-depth look at our healthcare services, we'll explore why 99.99% uptime is critical for hospitals, how outdated IT support models continue to hinder hospitals, and what it takes to build a compliance-driven healthcare network. 999 uptime. What it actually means for hospitals. Taking a cursory glance at healthcare-oriented IT services, a number that shows up frequently is 999 uptime, or 999s. But what exactly is it? Simply put, uptime is how often a system statistically stays operational within an established time frame. 999 uptime means that a system stays operational for 99.9% of whatever that time period is, typically a month or a year. 99.9% uptime is generally reliable in practice, but when looking at the numbers, it can still produce noticeable outages. Some systems measure their uptime percentage in smaller time frames than yearly. For a month, 999 uptime allows about 43 minutes of downtime. These outages can either happen all at once or be spread out over multiple incidents. 40 minutes spread across multiple incidents feels worse than one clean failure on the user's end. Coupled with this is how many decimals there are after 99.9 has a massive impact on a client's uptime experience. A flat 99% allows over 7 hours of downtime, then 43 minutes for 999s, then 4 minutes for 49s. How does this factor in for hospitals? Uptime is critical for any IT operation, but especially so for providing life-saving care. Even though 999s covers most business bases, the amounts of downtime allowed when measured per year can result in nearly 9 hours where a hospital's systems are non-functioning. In a line of work where lives are at stake, these moments of downtime could even result in people having their critical care prevented by system outages. Instead of the limited reliability of 99.9% uptime, Prestige HealthNet provides 99.99% uptime, allowing for less than a single hour of downtime on the yearly scale by utilizing solid redundancy and alerting. Layering our protective measures allows us to hit the perfect 4 nines needed for hospitals, letting them rest assured in their system's stability. Break fix, an issue plaguing hospitals. So what happens when a hospital's system stops working? Typically, a technician arrives, solves the issue, then leaves. Though this sounds simple, maintaining a system only whenever it goes down is working on a break-fix mentality. Break-fix is a reactive IT support model where service is provided only when an issue arises. A technician is called in to diagnose and fix the problem, and the client is billed for labor and parts on a per-incident or hourly basis. While this may be appealing to organizations with a low IT budget or minimal tech reliance, for hospitals, break-fix can lead to detrimental gaps in system uptime. By servicing issues as they arise, root causes can often be overlooked in favor of solving an immediate problem short-term, leading to cost spikes and productivity loss. Many hospitals also suffer from vendor bloat, where multiple IT vendors service their system. This results in few to none of the technicians having a comprehensive understanding of the hospital's IT systems. With no one being an expert in what the system needs, break-fix becomes more prevalent. Both the hospital and the vendors involved start putting out fires instead of getting to the bottom of what's causing the actual IT issues at large. Prestige HealthNet avoids this pitfall by providing a fully managed service at a simple monthly rate as a core feature. By owning, operating, and maintaining all IT infrastructure, Prestige provides expert engineering and a systemic knowledge of what our hospital clients really need. By being a single vendor, we also reduce the complexity of figuring out who needs to be contacted to solve an issue. Our 24/7 support and on-site service for seamless hospital operations prevents break-fix problems entirely. regulatory compliance, and patient record security. Another critical aspect of healthcare IT is ensuring that patient records are kept safe. Regulatory compliance in healthcare, such as HIPAA standards, ensures quality care for patients by protecting their health information and preventing fraud. And healthcare IT systems require extra layers of security to prevent data breaches and leaks. Hospital systems are often victims to breaches in compliance and security, with over 700 breaches of 500-plus records being reported annually. In 2025, a breach that exposed 5.5 million patient records occurred at Yale New Haven, one of the largest in recent years. Not only are patient records at risk, but healthcare organizations are at a significant financial cost, with each breach incident costing an average of $7.42 million per incident. What typically causes these breaches? Sometimes they come from a system being compromised by negligence, like any time a staff member doesn't fully sign out of their devices after using them, or equipment being stolen. However, there has been an increase in attacks from outside malicious actors through hacking and ransomware, making it the primary method by which healthcare records are exposed in recent years. In 2025, healthcare ransomware attacks surged by 30% compared to 2024, and although the year experienced less breaches in total, the increase resulted from a shift to focusing on external vendors and service partners, such as Prestige Technology. What does this mean for us as a service provider? Simply put, we're ready. We plan our defenses around the types of attacks that commonly plague healthcare institutions, building our HealthNet service from the ground up with compliance and security in mind. Our post-quantum cybersecurity measures and regulatory adherence with our healthcare offerings means our clients can rest assured in their safety. For a more in-depth look at how we structure HealthNet around compliance, read our blog post on HIPAA compliance and why it matters to Prestige Technology here. Conclusion: when minutes of downtime can disrupt critical treatment, when reactive break-fix models create costly instability, and when cybersecurity threats grow more sophisticated each year, hospitals need more than basic support. They need a purpose-built network designed specifically for the realities of modern healthcare. Prestige HealthNet is custom-built to meet hospital and healthcare needs. For hospitals looking to reduce downtime, simplify vendor relationships, and strengthen patient data protection, HealthNet offers a clear path forward.